Another five slide fix coming right at you. I'm recording all these back to back because I'm moving on Monday, so I'm so sorry that you're gonna have to listen to me drown on and get spammed that all of these are being posted on the same day. But let's get on into it. We're going to into the cortication of the aorta. All right, so pathophys. It is the narrowing of the descending aorta. That narrowing is going to cause a pressure overload, which means that the left ventricle has to pump against an increased resistance. Um, that obstruction is then how you get an upper body hypertension and lower body hypotension. Long term, it's going to lead to hypertrophy of that left ventricle, and in severe cases, we can actually end up with an aortic rupture or even a stroke. So, clinically, the hallmark symptom or sign is going to be that blood pressure gradient where you have hypertension in the arms and hypotension in the legs. You'll also see very weak and or absent femoral pulses. Or, if they're big enough, they're you can do popliteal and pedal. But normally we're checking femoral. Now, because of that high pressure in the upper body, they can have headaches, epistaxis or epistaxis, however you say, a nosebleed, and dizziness. Kind of think about when individuals have high blood pressure generally, they get headaches because of that increased pressure. Or if you can think of it's kind of like a migraine too. Migraines tend to be because of dilation of the blood vessels instead of constriction, but there's too much pressure in the brain area. Same thing is kind of happening here. There's too much pressure in the brain area. That's why they're getting headaches. Hopefully that makes a little bit of sense. And then in infants, if they have a severe cortication, it can present like heart failure symptoms. We've seen this a lot recently. Poor feeding, or they can look like they're having shock. All right, so treatment. Treatment is all going to be dependent on the age of the child and the severity. In neonates with a kind of ductal dependent circulation, we're going to give them prostaglandins to kind of help maintain that systemic perfusion. In older infants and children, we're looking at a balloon angioplasty or even a stent placement. For severe or ductal dependent cases that need surgical repair, we are going to do something called an end-to-end anastomatosis. You guys know I can't pronounce stuff. I'm trying my best, I promise. And then post-repair, we're looking for rebound hypertension, residual narrowing, and potentially even an aneurysm formation. All right, nursing care. It's really, really, really going to center on perfusion and watching for heart failure symptoms. Again, monitoring upper versus lower blood pressures, assessing femoral pulses, and comparing them with the radial pulses, watching for the tachypnea, the diaphoresis when feeding, the hepatomegaly, pre-cath, same thing as all the other videos, NPO, baseline pulses, checking allergies for contrast, making sure that we're getting informed consent from parents. Post-cath, if post-cath post-surgery, because there's catheter and a surgery, we are keeping the leg straight, monitoring for bleeding, checking distal pulses, checking perfusion, watching for arrhythmias, watching for hypertension, and clustering the care to reduce stimulation. For our parents, we're explaining the pathophys and overall physiology of the condition to them very simply, which is just going to be there's a high pressure in their upper body because of the narrowing, and then that narrowing is causing low pressure because there's not enough blood flow to the rest of their body. That is sometimes an easier way to kind of explain it to them. We're also going to teach them to monitor for that poor feeding, that increased work of breathing, those cool lower extremities. We're stressing the risk of recortication after surgery, so they have to make sure that they are following up with their cardiologist. After the repair, We're doing all the same stuff. We're avoiding strenuous activity. We're watching for chest pain. We're watching for headaches. We're watching for hypertension. We're doing cardiology follow-ups and carditis prophylaxis, that whole thing. All right, here are the resources, and that's your 5 slide fix on that one. Thank you guys, and let's get on into the next one.